Hey guys, welcome to another episode of Myths Around Lasers. Today I thought we would talk about how to optimize our treatment and get the most out of our laser devices. As you can see, I've got my willing participant who's ready to go for his treatment, as he absolutely loves it. Two questions I always ask before I even touch my laser is, first of all, what is my goal of the treatment? Why am I treating this patient? Have they got pain, inflammation, edema, swelling, tissue damage? You know, what is it? What makes that patient? It's not just because, oh, they're arthritic, so I'm going to laser them, because that's not actually telling me why or how the laser is actually going to help their condition. So really getting into the, okay, yes, they might have this condition, but I'm going to use my laser because this X problem needs to be solved. Secondly is anatomically, where is my issue? Because that's going to make a huge difference. You know, if I'm treating otitis and I'm trying to get to the ear, am I treating the inner ear and, you know, the external ear? Is it a dental condition, so I'm trying to get to either the back of the mouth, or is it just the front gingiva that I'm trying to reach? When we're looking at abdominal or thoracic conditions, you know, where abdominally do I need to be treating, or when I'm treating the thorax, you know, I've got my ribs that I need to try to navigate around as well. And then musculoskeletally, you know, a hip versus a shoulder versus a stifle versus an elbow, all completely different, and we need to find a way to treat those as effectively and as efficiently as it can. Now the biggest challenge is, you know, patient characteristics. We talked about that previously in terms of, you know, long fur, short fur, coat and skin colour, patient density. We've got a little bit more fat here than we'd like. I know, I just offended you, didn't I? You know, we've got all these things that we need to think about as well. Some devices will obviously take that into account for you, but it's just being aware of why we need to take it all into account, because it's all going to affect the dose, the wavelengths that we use, you know, all the things that we need to have a successful treatment. The other thing to think about is how are we going to apply the laser? Are we in contact with the patient or off contact? You know, we have different types of heads, so you know, different lasers with different heads, so whether you're in contact and able to compress some of those tissues and some of those that fluid out the way, so we're getting more light into deep tissue, or do we have a patient that actually just does not like being handled, or it's you know, there's an infectious reason where we don't want to be touching? Are we off contact? Because again, that's going to make a difference of how much light is going to be absorbed by your target tissue as well. And then, you know, is it a smaller area where a smaller spot size is more convenient than a larger one? Again, going to condense that light a little bit more efficiently. So there's lots of different things that we need to think about before we even kind of have turned that laser on to treat. And of course, health and safety, you know, are we wearing the right eye protection, and particularly if we're working near the face at all, because we do not want that risk. Now, Vinnies are a little bit loose at the moment because we're not quite treating yet. Obviously, they need to just be a little bit tighter so that there's no risk that they're going to fall off. So when it comes to actually physically treating, you know, like we say, in a lot of different machines, they're going to ask you, they're going to have some form of preset protocols. So how heavy is the patient? What's the body type? What's the coat length? What's the coat colour? And what's the skin colour? Again, all of that will impact how, at the end of the day, what dose is going to be delivered, maybe which wavelength is going to be selected, how long for, etc. So we have to make sure, if we are using preset protocols, we're inputting that as correctly as possible. The other side though is, some people will argue, well, I use my own settings, I calculate my own doses to be as, again, successful as possible. The thing you have to be careful of there is, we're very good at saying, right, the dose is 2 to 8 joules per centimetre square for this condition. Well, that's great, but that's not taking into account, again, coat colour, skin colour, coat length, muscle and fat density, and all those lovely other things that, again, we need to think about. So there's no right or wrong way, whether you use presets or whether you want to calculate your own. It's just ensuring that if we are calculating our own, are we taking into effect the entire, you know, if I'm, again, treating this hip where maybe I've got a bit of muscle coverage there, but not so much fat, versus abdominal, versus, again, shoulder, elbow, have we taken into consideration all those elements? And if we have an animal that's patchwork, so maybe a Dalmatian, for example, again, we've got darker patches there, so we need to take into account what wavelengths we're using, and again, what wattage particularly that we're using on those as well. And, you know, we've talked about it in the past with dose rates. All the different conditions have different doses, so it's really important to make sure you keep up to date with recent changes in terms of, you know, as more and more research comes out, we're finding that, again, we're seeing dose rates increase, particularly for deep tissue chronic issues. So being aware of all of that. So if I'm, you know, treating various areas on my laser, I personally like presets because I find it's quicker, it's easier, I don't have to calculate, but equally, you know, there may be times that don't. So then my laser is going to be ready to go. Now I'm really lucky, I'm using a Companion CTX IQ, and one of the advantages of using that is that it has the intelligent handpiece. So when it comes to treating the actual target tissue, so let's, for example, for Vinny, I'm going to treat his hip. Now, he's got hip dysplasia. As I've mentioned before, he also has lumbar issues. He's missing a lumbar spine segment. His psoas is just never happy. So there's lots kind of going on in this area. So for me, it's not just about, you know, getting my laser and just kind of circling around that hip joint, or just doing point to point around that hip joint, because actually there's so much more going on here. And this is one of the reasons when I'm talking to people and they're talking to me about cases, maybe they haven't had as much success with a case, quite often it's because not enough tissue is being saturated. So there's no point in just focusing around that hip joint. Yes, that may be the source of the disease, but actually there's so much more going on all in the surrounding muscles, up in that groin, all the way up to my lumbar sacral, and, you know, it doesn't just sit there. We all know about compensation. Compensation is a big thing. So we should never just be treating a small area. We should be saturating as much tissue as possible. Now, I know that often comes down to a time thing, and that's, again, why we need to be really understanding of our devices, and really figure out how to get the best out of our device based on the patient that's in front of us. So, you know, there are different methods of treating. Kind of scanning, for me, is one of the most efficient ways of delivering large dose, covering a large area. And that's why, again, I like the IQ, because people will say, well, how do you know that you've dosed the tissue? You know, you're constantly moving, so how do you know you've dosed the tissue adequately? And with the IQ handpiece, it tells me, because it's set to have an accelerometer in it, so that as I'm treating, if I'm going too fast, it will alert me. If I'm going too slow, it will alert me. And if I'm treating at the right speed, then it will tell me that it's happy at the speed I'm going, which means that I'm going to dose my tissue evenly across the area that I'm treating. And I know that that area is going to get the right dose. So that's why I personally love scanning, is because you can cover a larger area. There are times where point to point, you know, can be helpful if you're trying to do trigger points, if maybe you're not trying to cover a whole area. Again, there's various reasons, but if we're looking at larger areas, wanting to cover a larger amount of tissue, then scanning is the most efficient way, in my opinion, to do that. So tips for when you are treating an area: never just focus on a couple of areas around, you know, the joint itself. If, for example, we're treating this hip dysplasia, because there's so much more that's being impacted than just this area. Take into account the patient. You know, we've got quite long fur here, and then, you know, how am I going to apply it? Am I using contact? Am I using off contact? And then am I going to scan up and down the tissues and kind of crossing over? Are you pinpointing? But again, it tends to be more scanning methods for covering larger tissue areas. And I don't know if you can see, but Vinny has actually gone to sleep. Obviously I'm boring him. So those are my main thoughts around kind of optimizing patient treatment. What's your goal of the treatment? Anatomically, where is the location of the disease, but also what other tissues are impacted by that disease. When we're using our lasers, you know, what are the settings? Are we going to use presets or calculate our own? If we're going to calculate our own, are we taking everything into account and not just the fact that we have a dose rate, but actually have you considered all those patient characteristics in as well? And then actually treating the patient, again, how are you going to cover all of the tissue that you need to? How far do you need to treat? Other kind of things to think about when you are lasering, and I don't want to disturb Vinny now that he's gone to sleep, but you know, we shouldn't just be focusing on a lateral aspect. So in the past I've seen people just kind of, again, treat laterally, thinking that they're getting all that tissue, but actually lifting up and kind of going 360 around the joint space best we can, whether that's a hip, whether it's a stifle. Sometimes you actually find the better entry points are where you least expect it. So, you know, if we're trying to kind of go through the stifle, actually if we're going cranial, there's quite a lot of bone and kind of dense tissue here. Whereas actually if we go through caudally, it seems like obviously there's more tissue, but a lot of those are softer tissues. So sometimes you'll get better access to that joint space going in from a different angle. So always trying to treat 360 degrees around a joint space as best as possible whenever you can. Performing range of motion as well is another big one, because again, if we're going through range of motion, particularly joints like the elbows that are quite complex, it allows us to get into all those nooks and crannies that maybe we wouldn't get access to just by, you know, lasering them without that range of movement. So lots to think about optimizing treatment. It's not just a case of turn your laser on, pin in a number and kind of spot around, or just kind of wave it around like a magic wand. There's a lot more to it that you need to think about. I hope this video has kind of helped. If you do have any questions around any of the above, feel free to drop me a message. And somehow I'm now going to have to wake Vinny up to move on, but I think we may be here for a little while. But thanks again for watching, and see you guys in the next video.